Hi everyone, and welcome back again to my YouTube channel. Ndibai ekene muno. I hope you all are well today, and I hope you all are taking good care of your health. Thank you for watching my video. Thank you for always stopping by to watch my video. I'm really grateful. God bless you. If you are new, special welcome and thanks to you. I am Regina Mmado, a pharmacist. In this channel, I'll be discussing about health and wellness, diseases and treatment, foods and nutrition, and overall health related topics. So if you're interested in this kind of topics, hit that subscribe button and also the bell icon for weekly update. So in today's video, I'll be discussing about drugs you should never mix with alcohol and the danger involved. In this, I'll be discussing about the drug alcoholic interaction and example of those drugs that do interact with alcohol. So watch this video to the end to gather all the information. Let's dive in. Alcohol, it's a substance of abuse. Alcohol do interact with many drugs, including over-the-counter drugs, like the drug you go to the pharmacy shop and buy without showing any prescription medications, and also some herbal drugs. I'm discussing this not because all of us are drunkard or all of us are addicts, but sometimes or occasionally some of us do take from time to time, and at the same time some of us do take over-the-counter medication from time to time. So there is chance that one may combine one of these drugs knowingly or unknowingly. Knowingly means they know they are on drug, but they go ahead and take alcohol because they don't know the effect. And unknowingly is that there is chance one can forget that they took drug they took medication just some minutes ago, and they go ahead to take alcohol. And the effect, the danger of taking alcohol with some of these drugs varies depending on the class of the drugs, and also depending on how much quantity of alcohol that is mixed. And this mixture, I mean, it can be either by taking alcohol with the drugs together or the medication together, or dissolving it in alcohol and taking alcohol a few minutes after taking drug, or taking drugs a few minutes after taking the alcohol, either of the two, or even if it's just few hours. But it depends on the duration of action of the drug as well. Like if the drug is still in your blood and you take alcohol, it still produces the same effect. And because there are some drugs that clear up in the blood so easily, so you can take alcohol just few hours after taking those drugs. But in order to avoid any kind of this danger I'll be discussing, it is better to avoid taking alcohol when you are on medication, either over the counter or prescription medicine. Or you can ask the pharmacist that will sell the drug to you if it's okay to take alcohol with the drug, either few minutes after taking the, at least there should be gap, or is it okay at all to take it, or there should be some hours you leave behind or you leave in between before taking alcohol after taking the drugs. Though there are some drugs that contains alcohol, drugs like cough syrup or laxative, but it's normal. Those drugs doesn't have effect. And the effect of alcohol with some drug is not just because of active constituent, but also some of the additives that is used in production of those drugs. So the effects that mixing drugs and alcohol can cause, or the symptoms of mixing alcohol and drugs, are drowsiness. That is abnormally feeling sleepy during daytime, irrespective of how much time you slept last night. And this kind of sleep is so uncontrollable. The sleep will be controlling you and you can't even do anything. Dizziness, that is agio. You feel like everywhere is rotating, though it will not be like so severe to call it vertigo or dizziness. You feel dizzy. Nausea, vomiting, headaches. This is especially have to do with antihistaminic drugs, that is the drugs used for allergy, common cold, flu, or vomiting. Another effect of alcohol when mixed with drugs is liver damage. Yeah, especially with acetaminophen, of which I'll be explaining it down. And this is you have to take this very, very serious. Never ever mix paracetamol with alcohol. It's very, very dangerous. It can even cause liver damage and result in liver transplant, depending on how long you've been taking it and the quantity of paracetamol and alcohol you mix and how long you've been mixing them. You should never make this mistake. I'm saying it because paracetamol is very common. Anybody can go to the shop and get paracetamol, and it can come in different form, either as a whole or a mixture, because there are so many combination tablets these days. You can even buy medication for body pain. You may not know that alcohol is involved. So in order to avoid it, check the content of medication you buy, or you better avoid taking alcohol when you buy any kind of over-the-counter medication without consulting the pharmacist or any healthcare provider regarding the effect of alcohol and that medication. Another thing is it can cause heart problem, stroke, or internal bleeding. These have to do with drug that is used to treat clotting problem like thrombus or atrial fibrillation, that is heart disease, or disease that have to do with clotting of blood in the body. So this drug will help to keep the blood, like stop the blood from clotting. So depending on how the alcohol interact with these blood clotting drugs, it can either cause internal bleeding or inhibit it from acting, so that there will be clotting in the body or in the brain, resulting in stroke, or it can cause heart attack. And that effect is stomach bleeding, and that have to do with non-steroidal anti-inflammatory drugs, all these common pain medication that we do buy. So if it's mixed with alcohol, it can result in in stomach bleeding or ulcer, depending on how long you've been doing this. Another effect is impaired breathing, that is difficulty breathing, especially when taken with antihistaminic drug or asthmatic drug or this antibiotics called flagyl. It can cause breathing problem. It can even stop one from breathing or cause one to die. Or when it's mixed with opiate drug like codeine or morphine, it can seize one from breathing and it can lead to death sometimes. Another effect is poor coordination or loss of coordination. You see one behaving like a baby. They are not able to conduct themselves as human. And sometimes you may, if it's a garden, you may be thinking it's not just this little drug, this little alcohol that you took that is doing you like this. But you may not know if they have taken drugs that can increase the action of alcohol in their blood before coming to the occasion that lead them to start misbehaving even after taking a little amount of alcohol. Another effect is fainting. Mixing alcohol with certain drug can cause one to faint. Another effect is depression. Originally, alcohol can act as CNS depressant. So if you mix it with certain drugs, especially drugs used in treatment of anxiety or depression or seizure, it can lead to depression, and it can even lead to seizure. It can cause change in blood pressure, either increase or decrease it abnormally, and this is very, very dangerous. If blood pressure is lower than it should be, it's a problem. If it's also increased more than it should be, it's a problem. And mixing certain drugs with alcohol can cause abnormal change in blood pressure, especially drugs that is used to treat heart problems. Alcohol do produce this effect when mixed with certain drugs because it can change how drug acts, either increase the effect or decrease the effect of that particular drug. And that is because there is an enzyme that helps in metabolism of drugs that is called cytochrome P450, which has different subclass in it. So if alcohol and some of these cytochrome P450 enzymes do help in metabolism of alcohol to some extent. So, and if this alcohol happens to be an enzyme inhibitor or enzyme inducer, it can either reduce or increase action of the medicine. So if alcohol acts on a certain cytochrome P450 that helps to metabolize a drug, and it induces this enzyme, it will cause that enzyme to act on the drugs and metabolize it, therefore making it to be ineffective or reduce the action of that particular drugs. Or if it inhibits that particular enzyme that do metabolize the drug, then the drug will not be able to be excreted from the body, and it will cause the accumulation of that particular medicine and cause toxicity or overdose. And also it can affect the absorption of certain drugs, and if drug is not absorbed, it cannot produce effect, it cannot even be available in the blood, decreasing the bioavailability of that particular drugs. It can also increase the side effect of drug depending on all these changes. So now I'll be listing the drugs that do interact with alcohol. Now that I've explained the effect, this effect is general, so I'll be listing the drugs that do interact with alcohol. And this drug doesn't necessarily mean that it must be written on the name. These are the main constituent of the drug. If you check the content of the drug, the drug I'll be listing is what you will see, not the brand name, because the brand name is different from the chemical name of that particular drug, and sometimes it can be the same thing. Okay, so and this medication sometimes they do come in combination form, and a particular drug can be used for different things. Okay, so the best thing is just to know the name, and whenever you see such name on the label of medicine you buy, you know that this drug should not be mixed with alcohol. Number one class of the drugs that do interact with alcohol are drugs used for allergy. Drugs used for allergic reaction, cold, flu, or vomiting. These are antihistaminic drugs like loratadine, hydroxyzine, cetirizine, prometaxine, diphenhydramine, chlorpheniramine, brompheniramine, and many other antihistaminic drugs. Another class of drug is drug used for cardiovascular problem, especially in angina pectoris or chronic heart disease, like isosorbide or nitroglycerin. Those are the nitrate drugs. Another class of drug is drug used for treating sleeping disorder, that is drug that induce sleep, like loratadine, diazepam, chlordiazepoxide, clonazepam, buspirone, alprazolam, and many other drugs used in treating sleeping problem. And that class of drug is drug used for pain relief. Those are analgesic, be it severe pain or all this common pain or fever, like paracetamol, ibuprofen, diclofenac, naproxen, aspirin, celecoxib. These are mainly for arthritis. These two are major. And also opiate drugs like morphine and codeine, very important, because codeine is mainly used as antitussive, that is used in cough syrup. So if you're taking it and it's containing codeine, you should not mix it with alcohol. This doesn't mean that once you take it, or if you mistakenly take it 1 or 2 times, you have those effects. But if you don't quit, if you are a victim of this and you're supposedly doing it, you don't quit, you are endangering your own life. And many other analgesic drugs, because I'm just giving few examples. It doesn't necessarily mean that I have to mention all the drugs that do interact with alcohol. And that class of drugs are drugs used for anxiety and depression, such as duloxetine, amitriptyline, desipramide, clozapine, clomipramine, escitalopram, and clonazepam. And that class of drug is drug used for clotting problem, that if someone is having thrombosis, that blood can easily clot inside the vein, therefore blocking the flow of blood in the system. So this drug can be given to help the blood not to clot. Example are warfarin, heparin. This drug should not be mixed with alcohol, because if one do, it can even cause internal bleeding, like I explained earlier, or heart attack or stroke. Another class of drug one should never mix is CNS stimulants, such as amphetamine or dextroamphetamine. These drugs are mainly used for those that are doing outside activities like running and other sports, but it should never be mixed with alcohol, because alcohol on its own do act as CNS stimulant as well as CNS depressant at the same time. Another class of drug one should never mix with alcohol are antibiotics, like metronidazole, tinidazole, amoxicillin, antifungal, ketoconazole, clotrimazole, alcohol, or other antibiotics drug. And that class of drugs one should never mix with alcohol are the ones used for seizure. If someone is having epilepsy, these drugs should not be mixed with alcohol. Example: valproic acid, phenytoin, carbamazepine, gabapentin, pregabalin, and lamotrigine. And that drug one should not use with alcohol is drug used for psychiatric problem like lithium and valproic acid. And that class of drug one should not use is drug used to reduce cholesterol level in the blood like statin, lovastatin, atorvastatin. And that class of drug one should not mix is anti-diabetics drug like glipizide, metformin, and other oral anti-diabetic drugs. And that class of drug are drug used for indigestion and heartburn such as cimetidine and other H2 blockers. This effect of alcohol varies with age. It's even more common in older people because older people are more prone to taking drugs every day than younger people, because the older one gets, the more drug dependent they become. If you have an old man or woman in your house who is on drug, make sure they're not taking alcohol. And if they are addicted that they cannot just stop, then they have to discuss with their healthcare provider to guide them on how to take alcohol, if at all they must have to, along with the drug, in order to be on the safer side. So this comes to the end of today's video. I hope you enjoyed this video and I hope you found it useful. Please, if you did, give me a thumbs up, subscribe to my channel, share this video to your family and friends. Thank you for watching and do have yourself a good day. Bye bye.